Hi everyone, welcome to another question answer session for MRCS examine. This channel is dedicated to MRCS examine who wants to pass the MRCS exam very easily. So here is one of the question of our session, and first of all we have to read the question very carefully. A 52 years old female underwent a cadaveric renal transplant and recovers well post-operatively. Her immunosuppression regime consists of tacrolimus. Which of the substances listed below should be avoided? So after careful reading, we have to find out the key point, that means most highlighted point here. So a 52 years old female underwent cadaveric renal transplant. That means she receives a kidney which is collected from a cadaver and recovers well postoperatively. Her immunosuppression regime consists of tacrolimus. So as the graft was a foreign body or received from other person, so it acts like a foreign body, and to uh, compete or compatible with the recipient body, tacrolimus is used. So which of the following substances should be avoided? So which of the following juice or following substances should be avoided in these patients? Here are the options such as the paracetamol, apple juice, penicillin, orange juice and grapefruit juice. So which will have to be avoided, or which has interaction with the tacrolimus? So we have to find out one of the options which should not be used according to the tacrolimus, because the patient receives tacrolimus. So any toxicity of the tacrolimus can cause the damage the grafts that is received for this patient, which is the kidney. So here we can see the tacrolimus. Tacrolimus is metabolized by the cytochrome P450 enzyme system, and this system is inhibited a number of naturally occurring substances or a number of foods or any other substances. So if we use these substances, it will inhibit the P450 enzyme. So P450 enzyme will not act on the tacrolimus, and the tacrolimus, on the one hand tacrolimus toxicity develop, and on the other hand if tacrolimus not activating, so the kidney function will be deteriorate gradually and the graft will be rejected. That means the kidney will be rejected and kidney will be damaged within very short time. So the substances which inhibit the cytochrome P450 enzyme, there these should be avoided. Here we can see there are different options such as the water, fruit, grapefruit, water crease, St. Juice words. So they interfere with the P450 enzyme. That means they inhibit the P450 enzymes. So these should not be used in the with the tacrolimus because it hampers the function of P450 enzyme. So tacrolimus will not act on P450 enzyme. So tacrolimus toxicity occur on the on side, and on the other hand kidney will be rejected. So these all should be avoided in the immunosuppression and patient taking tacrolimus. So here we can see some picture. This picture, actually these substances naturally very helpful for the body, but it should not be used with the tacrolimus, such as the St. Joe's watch. This is some of the possible health benefits, such as the mood boost and depression relief, anxiety relief, premenstrual symptom. It reduces the symptom of premenstruation, and premenstrual symptom is one of the disaster condition for a lady to tolerate. So it reduces the menstrual syndrome and reduces menopause related symptoms such as after menopause or around the menopause or before 1 to 2 year of the menopause, the patient sometimes feel like sympathetic overstimulation, and it is very irritable for the patients, and they frequently visit the doctor's chamber, uh, which will cause the economic burden for the patient, economic, social and familial burden. So St. Joe's what it may reduce the menopause related symptoms, and it also the sensational affective disorder and smoking cessation. So St. George what it has some of the uh, health beneficiaries, but we have to avoid it in case of the renal transplanted patient who is receiving tacrolimus. In the second picture, we can see the water crease here. This is a plant, and it's washed and ready to eat. Here we can see it is very helpful for our body, but in case of patient who is taking tacrolimus, it should be avoided. In the third and option, this fruit are very popular among us, and we know that this is the grapefruit, so it also be avoided. So our final answer is grapefruit juice. Grapefruit juice, in case it acts on P450 enzyme, and so it inhibits the P450 enzyme. In this case, tacrolimus will not act on this graft resistant patient, and graft will be failed. So grapefruit juice should be avoided.